This was a very young, attractive lady, the model, and she had totally discolored gum, as you can see here before. And she was very unhappy about it. What I did was I treated the entire upper jaw and the lower jaw. You can see the after.
It's nice. Looks clean.
Yeah, it's a little bit overexposed as far as the picture itself, but you can see the before and after. It makes a tremendous, tremendous difference. One thing I'd like to mention, how a minor issue can make a big difference. If you look at this tooth, it looks a little bit shorter than this. All I've done in this case, a little bit minor reshaping of the gum tissue around it, make this one equal. So it's incredible.
You know, I'm a teeth person. I look at women's teeth and the gums. I think with the healthy gums, it's kind of a sexy look.
Absolutely.
It looks good. Now, with the gum bleaching, I mean, what's the technique? I mean, what are you doing?
Yeah, the technique, a number of options, a number of treatment available. I've tried laser. The technique, my own technique, which was published in the International Journal of Periodontics and Restorative Dentistry, is highly respected publications, is like New England Journal of Medicine. And that's the first publication that I published in 1990. Since that time, I've been doing the follow-up and the research using laser, my own technique, as well as what I would call
So there's more than one approach?
Yes. Bleaching gums. Now, depending on the case, if you have got a really deeply seated, pigmented, colored gums, the approach might be a little bit different than when you have a superficial layer or discoloration of the gum tissue. So, again, I'd like to emphasize, unfortunately, not too many people know about it, that this treatment available that can change their lives. In addition, the dentists even do not know. Although I have published,
and it's an inexpensive procedure. We talked about the price of it, and I told you this. It seems like everybody would want to do it if they have that problem. They just don't know. Obviously, it's available, and that's why we invited you on the show. Now, what about downtime, and how long does it take? They go to your office?
I get many patients coming from. In fact, last week I had a patient came from Toronto, Canada. What I usually do is email me a photo of the face, or what I would call a smile design profile.
From Canada?
From Canada. I look at the case, look at the photos, talk to her on the phone, and then she came Friday. I took care of it Friday afternoon, back to Toronto Sunday.
A 1 hour
Sunday
procedure?
1 hour straightforward. There's no downtime. There's no major discomfort.
Does the color come back?
No. In fact, I've got some of the cases that I would like to show you. 17 years follow-up. Let me show you. This is a case that actually, the title even say, for the first time you can change the color of your gums. What I did was, I treated this segment, left this untreated to see the contrast.
So that's one mouth. Half and half.
The white line, this side is treated, untreated. You can see the dark patches. And then what I did was, the same patient had actually, Alex was a very young professional, heavy pipe smokers. So this shows the appearance of the upper jaw, the totally discolored and bumpy appearance of the gum tissue. This is 4 weeks after treatment. Now, the question, your question, whether or not it comes back as far as the relapse, this was taken, the same patient, 17 years after treatment. You can see the entire upper jaw and entire lower jaw, the gum tissue has been treated. So it does not. The only thing I should add, smoking obviously is one of the causative factors contributing to the discoloration of the gum tissue. In those cases, I had maybe statistically 3 to 5%, just tiny spots here and there that I can just do with a final touch-up, but take care of it.
Is this something that develops? Is this genetic? They're born with it, or they're not?
It's a genetic, like the color of your skin, a dark complexion. Some people, as I said, is very common African American populations, Middle Easterns. It doesn't mean necessarily the gum tissue is not healthy, but the problem in this case is cosmetic aspect. It poses a major aesthetic problem for the patients. Let me show you another example. This is another case. Louise came to me. She was extremely unhappy about the discolored gum tissue, as you can see here, before treatment. And what I did in her case, I took care of the deep pigmented or discolored gum tissue. But in addition, if you pay attention here, you can see she has uneven cutting edge of the teeth. Just minor corrective procedure as far as the cutting edge, and make them so beautiful. So she has this gap, and we are planning to do an orthodontic treatment to close the gaps, or you can put a veneers to close the gaps. But the impact, the compliment that she received from her friends, incredible. Changed her personality.
We're going to take a quick break. We come back, more photos, and what you're doing for, as you call it, a gummy smile. And you show too much gums when you smile. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Up next, more photos and what can be done for a gummy smile. We'll be right back.